The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. Last week, we heard that 2 Digby area family doctors will finish practicing at the end of November, just 1 year into their 3-year contracts at the local collaborative practice clinic. While the health authority says they're leaving to practice elsewhere in Nova Scotia, that's cold comfort to the residents of Digby, where those doctors were serving a clinic with nearly 10,000 patients. Mr. Speaker, will the minister acknowledge that collaborative practice teams alone aren't enough to keep doctors in rural Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. I want to remind the member that, in fact, we're taking numerous steps to support the recruitment and retention of physicians and other primary health care providers in our province. Mr. Speaker, we're expanding the opportunities for training. We know that when residents train in a particular community, I believe it was last fall that Mardocs, the Association for Medical Residents for the Maritimes, released that about 75% of physicians who trained, completed the residency in the province, stayed in the province. So by extending family physician residencies to 10, we can expect 7 to 8 of those physicians to stay and practice in Nova Scotia on an ongoing basis. We've done a similar initiative with the nurse practitioner program, Mr. Speaker. We've expanded the seats at Dalhousie for training, and we've also provided a program to help support financially a number of those nurse practitioners.
The honourable member for Cape Breton Centre.
Mr. Speaker, Diane Allen of Cornwallis often waits 60 days for a routine appointment with her nurse practitioner in Digby. That wait time was typical back in January of this year when she spoke to the press about her experience. Imagine how long people will have to wait now that their community is losing 2 out of 3 doctors. And now, without these physicians, people are worried that the Digby ER will not be able to keep its doors open. Mr. Speaker, what guarantee can the minister provide that the Digby ER won't close as these doctors leave?
The Honourable Minister of Health.
Thank you, Mr. Speaker. The NSHA continues its recruitment efforts throughout the province when vacancies come up. They continue to provide and make use of the incentive programs that are provided by the province to encourage physicians to practice in areas most in need. That work will continue. The support and the compensation opportunities are there. And indeed, Mr. Speaker, I'm pleased to highlight that the community in and around Digby has come together, working together with a collaborative group of individuals to welcome new physicians and healthcare providers to their community, which I believe, from what I've heard from physicians on the ground, have been well received, and I think that's an important step that will help with recruitment efforts in that community.